Right, that's right.
Will someone tell me when to play one? Okay.
Well, good morning and welcome. I first want to thank all the participants. As I just said when I was in front of the table here, many of these individuals have a very difficult time traveling. So truly appreciate the fact that they made that effort. As Bree and Maddie and Stephanie are well aware of, telling the truth in today's cancel culture is not necessarily easy. You can pay a pretty heavy price for it. So I really appreciate everybody participating in this, either personally or via video, their willingness to tell the truth. It's a real shame that we're having to hold this roundtable. Had government officials, the heads of our healthcare agencies, had they been doing their job, had they been honest and transparent with the American public, we wouldn't be here today. But the very sad fact of the matter is they haven't. We're billing this as a discussion about the vaccine mandates, which is the current policy response to COVID that will rob us of freedom and take an enormous toll on human beings, on our economy. I think every American really needs to ask themselves the question, since the beginning of this pandemic, have the policies followed by the U.S. government, and you can ask this governments of the world, but we're going to focus on the U.S., have they worked? Have the shutdowns worked? Have the mask mandates worked? Have the vaccines and are the vaccine mandates going to work? I'm sure we all hoped and prayed they would have. But the fact is, we have close to 750,000 Americans who it's now reported died with or from COVID. 750,000. In the U.S., we rank 23rd out of more than 200 nations. And that's a bad ranking in terms of number of deaths per 100,000. We are at 220 people per 100,000 died from COVID. Sweden, remember everybody taxed Sweden? Because I think personally that they approached this rationally. They protected the vulnerable, they isolated the sick, and they let the rest of the society carry on as safely as they possibly could. We're at 220 per 100,000. Sweden is at 145 people per 100,000 dead from COVID. One of the huge blunders of our government response is we not only ignored, but higher-ups in the agencies sabotaged early treatment. To this day, the NIH guidelines for treating COVID are to basically do nothing. Now, as far as I know, in medicine, with any disease, we're always talking about early detection, allows for early treatment, produces better results. I mean, it just makes perfect sense. Why didn't we do that with COVID? The only treatment prior to hospitalization that's recommended right now is monoclonal antibodies, and it's difficult to get those. So the fact of the matter is, when we turn our attention to the vaccines, I don't think there's a person here that is anti-vaccine. Obviously, those that have been injured by vaccines were very pro-vaccine. But we have to ask ourselves, did the vaccines work? I have one chart behind me, which just combines a timeline of percent of Americans being vaccinated, and you can see we've approached, I think over 60%. But at the same time, we show the average number of daily cases. You can see we had a huge surge toward the tail end of 2020. And even before the vaccines could even kick in, that surge was winding down. And I think we were at that point all hoping and praying that the vaccines would just stomp this thing out for good and we can move on with our lives. Now, had the vaccines been effective. Had they done that, you'd see a tailing off of that curve basically into infinity. But that's not what we see. We see a whole new surge, a surge of a variant called Delta. Now, our government officials, I talked about them not being particularly honest, not being particularly transparent. We invited them all here. Representatives from the heads of the CDC, Secretary of Defense Austin, Secretary of Labor Walsh, Secretary of Transportation Buttigieg, FDA Acting Commissioner Woodcock, HHS Secretary Becerra, NIAID Director Fauci, NIH Director Collins, together with the CEOs of Johnson & Johnson, Moderna, Pfizer, and BioNTech. None of them showed up. None of them showed up. President Biden, for his part, in terms of honesty, July 21st, just a couple months ago, said if you're vaccinated, you're not going to be hospitalized. You're not going to be in an ICU unit. You're not going to die. You're not going to get COVID if you have these vaccinations. He said, this is a pandemic on the unvaccinated. How I wish he was right when he said these vaccines were going to be that effective. But the fact is, they haven't been. If you take a look at what's happening in the UK, over the last 7.5 months, and again, I wish we had data in the US so we could point to that data, but we don't. If they're collecting it, they're not sharing it with the American public. In the UK, over the last 7.5 months, 80% of their cases have been Delta variant. Of the people who have died from COVID in the UK with the Delta variant over the last 7.5 months, 63% have been fully vaccinated. Over the last 4 weeks in the UK, 78% of those that have died with the Delta variant from COVID, 78% have been fully vaccinated. I hate to steal the thunder from one of our participants here, but in a slide, they've got a very dramatic decision tree when it comes to vaccine mandates. The first decision square says, are COVID-19 vaccines effective? And has 3 lines, yes or no. If the vaccines are effective, then the next decision box says, then mandates are pointless. Right? I mean, if the vaccines are effective, there's no need for mandates. If you want to get the vaccine, you've got it, you're protected, and you don't care whether somebody else gets vaccinated. The other decision line, are the vaccines effective? If it's no, then it also points to the exact same box. Then the mandates are pointless. There are 3 realities that our federal health agencies, President Biden and his administration are ignoring when it comes to mandates. And again, you have to understand the destructiveness of these mandates in our healthcare system. You know, I've been talking to the doctors and nurses, the heroes of COVID, the people that had the courage and compassion to treat COVID patients. So many of them caught COVID. Some died, most survived. Now they're treating the vaccine injured. They will not get vaccinated. We will lose decades worth of experience in our healthcare system that is already experiencing significant shortages of workers. What are we doing? How insane is this? But one of the things that our policymakers are ignoring is natural immunity. Why would we force a vaccine that's not as effective as we all hoped? Why would we force that on people who are naturally immune, where the science tells us those with natural immunity probably have better and more long-lasting immunity than those fully vaxxed? The other reality that our policymakers are denying is that the vaccines prevent infection, prevent transmission. They're not. It's obvious they're not. So again, if you're vaccinated and you can still get infected and still transmit, what is the rationale for the mandates? There is no rationale. Like that decision box said, they are pointless. At the same time being utterly destructive. And then, of course, what we're really going to be discussing today, the third reality that our policymakers are denying is the vaccine injuries. I was introduced to Brianne Dressen in June of this year when I held an event in Milwaukee, just allowing, and Maddie and Stephanie, when I just held an event in Milwaukee to allow a couple, I think 5 vaccine-injured individuals just to tell their story. That's it, just to tell the story. But back then, their main message was, we just want to be seen, we want to be heard, We want to be believed. Why? Because unless the medical establishment, their doctors, our health agencies are willing to acknowledge just the possibility of vaccine injuries, if you're not willing to acknowledge the root cause of a condition, of an injury, of a malady, of an illness, how can you hope to cure that illness? How can you help these individuals who participate in some of the trials to benefit humanity? How can you help them fully recover if you're not willing to admit that vaccine injuries are real? The final slide I want to put up here is a chart that is laying out the reality of vaccine injuries. Now, this is from the government, the CDC, FDA's own safety early warning surveillance system, one that they touted in October. Man, they were going to pay attention to this. If they see a vaccine injury that even results in a couple of lost days' work, they're going to have somebody from the CDC on the phone following up that vaccine-injured person. You're going to hear from the vaccine injured on this panel today that is so far from the truth, so far from the reality. But if you just compare the adverse events for the standard flu vaccine versus COVID, you can see that there's something happening here, something that needs to be acknowledged, something that the Walensky's and the Fauci's and the Woodcocks, the President Biden ought to be concerned about. And so if you look over the last 25 3/4 years with the flu vaccine, on average, there have been 7,596 adverse events per year. In 10 months with the COVID vaccine, we're up to 837,595. This is a chart from last week. These are update numbers. On average, the number of deaths reported on VAERS for the flu vaccine is 78 per year, 78. The updated figures today are 17,619. That is 225 times the number of deaths in just a 10-month period versus an annual figure for the flu vaccine. These vaccine injuries are real. And as the individual Green Bay Packers star Ken Ruckers, who introduced me to Bree and her group, as he stated in that meeting in June, vaccine injuries are rare and mild until one happens to you or your loved one. So again, I would like to introduce, I'm proud to introduce Ms. Brianne Dressen, who will tell you her story, and we'll hear from Bree a couple times today. Brianne.
Thank you, Senator Johnson, and it is truly an honor to be able to sit here with you and for you to, it's just been incredible to see how you've dedicated yourself, you know, against all the odds and the pressure to back away from the truth and to silence us like everybody else. And so we really, really appreciate you being willing to stand with us and fight with us.
Keep the mic as close as possible.
So my name is Brianne Dressen, and most of you have never heard of me, and most likely have never heard of most of us here. We're just everyday Americans. We are Republicans, we're Democrats, libertarians, independents. For us, this is not political. This is a human issue. We're here to tell our stories, ones largely ignored and silenced, and we hope that you listen, and we hope that you ask questions. I'm a wife and a mom, and I'm a preschool teacher. I suffered a life-altering reaction to my COVID vaccine on November 4th, 2020, almost a year ago to this day. I suffered a cascade of neurological symptoms that persisted for months. And while my life has improved, I still feel like I'm being electrocuted 24/7. For the first several months, I was totally alone. I kept my symptoms and my story completely to myself. I thought that this was an isolated incident. But in the spring, I started finding more and more like me. And before we knew it, there were thousands of us All of us unable to receive medical care, recognition, either from the drug companies, the CDC, the FDA. We all suffered the same constellation of symptoms, which is very strange. It's a brand new disease. Nobody knew anything about this. We had it happen with all of the brands. Over 70% of us had had no previous existing health condition. Over 94% of us have not had any problem with any previous vaccine. 98% of us have had all of our previous vaccines, the vast majority of us even having our flu vaccines. We are not anti-vax. Also, because the CDC and FDA continued to ignore our pleas, our begging, we decided we needed to act because we started to see this happen to kids like Maddie. So from our sick beds, we sprang into action. We reached out to our elected representatives, both blue and red. We reached out to the COVID committee. We reached out to all of the representatives on the Health and Education Committee. If you have an elected representative in your state, they have heard from us. We also have been to the NIH. I myself was one of those lucky few to be able to go. We participated in studies across the country with very well-accomplished academics from reputable research institutions. None of them can get their research published. They go journal after journal after journal, being turned down one after the next after the next. We then reached out to the media, being repeatedly told that we can't make the vaccines look bad. We reached out to our major health organizations like the AMA. We reached out to our state health boards, our state health departments, all of them persisting in the narrative that if this was really happening, the CDC and the FDA would have said so. We are completely on our own. All we have is each other. We've been branded as anti-vax. Misinformation. 24 hours after Senator Johnson hosted our last conference, we had our Facebook support groups pulled apart. I lost contact with 8 actively suicidal people, just like that. So, after months of isolation, aggressive suppression, we began to connect with others, compassionate and concerned citizens, academics, physicians. They see the harms and they see what is happening to the injured and the lack of transparency in the race to vaccinate the world. We need the CDC to acknowledge us. A very simple act would change everything for the sick and suffering. We also need to just begin the conversation. This will lead to real healing for the injured, for appropriate and objective review of the science, to establish an environment for open dialogue, so ultimately we will be able to make rational and fully informed policies and decisions. Thank you so much for your time. I'm going to turn the time over to Dr. Wastilla.
So, Bree, let me just quick, I'll introduce Dr. Wasilla and also Dr. Doshi. 2 colleagues, Dr. Wastilla will be the person that introduces everybody else on the panel, but Dr. Wastilla is professor and Park Davis Chair of Geriatric Pharmacotherapy in the University of Maryland, Baltimore School of Pharmacy. Dr. Peter Doshi is the Associate Professor of Pharmaceutical Health Services Research at the University of Maryland School of Pharmacy and the editor at BMJ. So again, Dr. Wastilla will be introducing the rest of the panel members today. Dr. Wastilla.
Good morning, everyone. Oops, drop close to the mic, okay. I'm usually a podium hugger anyways. Good morning, everyone, and really appreciate you, Senator Johnson, for hosting us today. And I really want to thank all of our speakers, especially the vaccine injured, because you are showing us your vulnerability and your courage, and you inspire me at least. My name is Linda Wastella. I'm a professor. I'm trained in pharmacy, public health, and health policy. I teach and conduct research at the University of Maryland School of Pharmacy, and my views are my own. Before I tell you a little bit about myself and then how the very credentialed scientists and clinicians came together, I want to describe the format for today. You are going to hear testimonies from two kinds of people. You're going to hear from the experts, the clinicians, the scientists, the lawyers, the patient advocates. And more importantly, you're going to hear from the vaccine injured. You're going to hear very powerful testimonies about their experiences. I would characterize myself. Okay, thank you. Okay, closer. I would characterize myself as a successful mainstream researcher. I have a 30-year career. I have tenure, I've won awards, I've gotten big grants, I've published in big journals. I've devoted my professional life to using research to understand and improve access to pharmaceuticals to better the health of the populations, especially those vulnerable populations. Speaking today is profoundly uncomfortable for me. I prefer the quieter life of an academic. I'm not a media personality. And opposing public health policies is not something I ever imagined myself doing. But here I am, all because of a single announcement this past spring mandating all students, staff, and faculty at my school system, to get vaccinated before returning to campus this fall. The announcement chilled me on a personal level, as the mandate impacted not only myself, but my two college kids, one of whom has a lot of medical conditions. It also concerned me on a professional level. How can a university system mandate an as yet unapproved product whose potential harms were still being studied? I reached out to colleagues, discovered I was not alone. This past June, a group of us, scientists, clinicians, and advocates, we filed a citizen petition to the Food and Drug Administration to express our concerns about the rapid mass rollout of vaccines, which were not yet approved. We dubbed ourselves CALM, the Coalition Advocating for Adequately Licensed Medicines. In our petition, we didn't ask the Food and Drug Administration to pull the vaccines from the market. Rather, we outlined open questions about them that must be answered before granting vaccines full approval. We focused on emerging and unknown safety concerns impacting the general population, but as well as what we considered at-risk groups for vaccine problems, including children and adolescents, previously infected persons, and pregnant and nursing women. FDA denied our petition the same day it approved Pfizer's vaccine. And now, not only do we not have answers to our questions, but we have expanded mandates affecting federal and defense employees, private businesses, healthcare workers, universities, and public school systems, among others. We still know nothing, absolutely nothing, about long-term vaccine harms because the vaccines haven't been out that long. Indeed, 20 months in, we barely understand immediate harms from the vaccines. How can we possibly provide informed consent without this information? So today we stand or sit before you as individuals, and I want to reiterate, we are not an organization. Indeed, we are the epitome of grassroots. This all came together through word of mouth. And to be clear, absolutely clear, we are not opposed to vaccines. Rather, we oppose their mandated use. We are citizens who have done our civic duty, but when we experience serious adverse effects, we're left high and dry by FDA, CDC, the NIH, and medical professionals. We are scientists alarmed by the toxic environment in academia and scientific publishing. We are military leaders concerned about vaccine safety in the armed services. We are clinicians who want to treat patients harmed by vaccines, but whose practices are limited by their employers and professional boards. And we are lawyers and patient advocates seeking help for our injured clients and their families. We are the people you haven't heard from. And we have nothing, absolutely nothing, to personally gain from being here. Indeed, we have everything to lose, including our jobs, our titles, our livelihoods. but we don't intend to go away until we see some real change. Please understand, this is not a compromise to decide which is worse, the disease or the vaccine. Such a premise is myopic and ignores the people who serve the public's health and now require care they've yet to receive. I hope, we can all agree adverse events that disable and kill are not acceptable outcomes. I do believe we can do both. Provide vaccination, access to those who choose to be vaccinated, and we can assess the safety of these products in a rigorous and thorough fashion in order to provide safer treatments and protocols. Today, let's forget the tribes. Let's forget left versus right, red versus blue, politically correct versus politically incorrect. Let's forget vaxxed versus unvaxxed. We just ask that you listen. We aim to challenge the perspectives and things you believe to be true. In turn, we ask for you to challenge us. Thank you. Too close?
No, you were.
We're close. Perfect, okay.
Everybody have the mic literally within about 2 inches of your mouth.
I'm also your MC for the day, and I'll be introducing individuals, our next speakers, in groups. And the next group of people that are going to speak are two individuals, one who's an aviation pilot, Cody Flint, and the second is Lieutenant Colonel Teresa Long, who is the brigade surgeon for the 1st Aviation Brigade. They're going to talk about vaccines and mandates and how they impact our national safety, as well as their personal lives. And I will then, and then we'll have another group of people. So thank you. Cody?
Good morning, and thank you, Senator Johnson, for this opportunity. My name is Cody Flint. I am a 33-year-old husband and a father of 2 young boys. I'm an agricultural pilot by profession with over 10,000 total flight hours. I have been very healthy my whole life with no underlying conditions. I received my first dose of the Pfizer COVID vaccine on February 1st. Within 30 minutes, I developed a severe stabbing headache that later became a burning sensation in the back of my neck. 2 days after vaccination, I got in my airplane to do a job that would take only a few hours. Immediately after taking off, I knew something was not right with me. I was starting to develop tunnel vision, and my headache was getting worse. Approximately 2 hours into my flying, I pulled my airplane up to turn around and felt an extreme burst of pressure in my ears. Instantly, I was nearly blacked out, dizzy, disoriented, nauseous, and shaking uncontrollably. By the grace of God, I was able to land my plane without incident, although I do not remember doing this. My initial diagnosis of vertigo and a severe panic attack, although I've never had a history of either of these, was later replaced with left and right perilymphatic fistulas, eustachian tube dysfunction, and elevated intracranial pressure due to brain swelling. My condition continued to decline, and my doctors told me only an adverse reaction to the vaccine or a major head trauma could have caused this much spontaneous damage. I've had 6 spinal taps over 8 months to monitor my intracranial pressure, and 2 surgeries 8 weeks apart to repair the fistulas. I have missed nearly an entire year of my life and part of my children's lives. Days of baseball games, playing in the backyard, and just picking up my kids to hug them have been replaced with being trapped in a sick body, doctor visits, invasive procedures, and more questions than answers. I don't know if I'll ever be able to fly an airplane again. This vaccine has taken my career from me and the future I have worked so hard to build. I have used all of my savings to pay medical bills and just to be able to survive. My family and I are on the verge of losing everything we have. I was and still am pro-science and pro-vaccine. The main issue rests squarely on the fact that the FDA, CDC, and NIH refuse to acknowledge that real lives are being absolutely destroyed by this vaccine. The federal government has yet to help a single one of the vaccine injured. It was my understanding that the federal government accepted the responsibility of helping people injured by this vaccine, considering they gave the vaccine manufacturers full legal immunity from people like me. The government has left us nowhere to turn for help. My family and I masked up, stayed indoors, and dodged COVID for over a year. We did what was asked of us by being part of the solution. That solution has taken everything from me and my family. We have been ignored and silenced. It is not right, and it needs to stop now. It is time for the federal government to do its part by acknowledging us and helping us. Does anyone really think it's fair to make the vaccine injured wait years for help? I think we can all agree that refusing or delaying the help we need is unconscionable. We urgently need this help. Thank you.
Thank you, Cody. Thank you, Cody. And now Dr. Long.
Hello, my name is Lieutenant Colonel Teresa Long, and I'm an Army Aerospace Medicine Specialist. Senator Johnson has invited me here to make a statement to him regarding my opinion about the life-threatening adverse side effects of COVID-19 vaccine. My opinion is formed from my medical education, training, and my firsthand experience treating soldiers injured by the vaccine. My views are my own opinions and do not reflect that of the United States Army, the DoD, or any entity thereof. This statement is made as a protected communication under the Military Whistleblower Protection Act, Title 10 U.S.C. 1034. I would like to also disclose that I have no financial interests. I believe the COVID vaccine is a greater threat to soldiers' health and military readiness than the virus itself. Over 200,000 service members have rejected the vaccine, yet the military is pressing forward without regard to the damage to the morale and readiness to process these soldiers out. We have never lost 200,000 soldiers on the battlefield in a few months. Taking soldiers out of uniform has the same impact on readiness as losing them on the battlefield. I enlisted in the Army and completed basic training by the age of 17. I am now a board-certified aerospace medicine specialist with a master's in public health. I have spent the last 30 years serving this great country. I have gone from an almost homeless teenager on welfare to a lieutenant colonel physician in the United States Army. I have truly lived the American dream. Everything I have and everything I am, I owe to Christ alone. I recently had a colleague on social media point out that my career in medicine was not the typical path. She was right. You see, in my first year as an Army physician, I suffered catastrophic complications after the birth of my daughter at the hands of fellow physicians. The impact on my family and my life has been enduring, painful, and life-changing. My plans for my family and my career abruptly pivoted. It was during this time I tried to ensure something good would come out of something very painful. I did what we do in the military. I did an after-action review on what went wrong with my care that resulted in such disastrous outcomes. I attempted to engage all involved and start a dialogue for change. You see, you will not change something if you will not acknowledge it's broken. Yes, it wasn't the traditional path. It isn't the path I planned, but it was the path laid out for such a time as this. In 2018, I had the privilege of attending the Aviation Safety Officer course and mishap investigation training. The course director asked me on the first day, "Why would a doctor waste time in this course? What are you hoping to get out of this?" I responded, "Sir, we crash 3 Boeing 747s packed full of patients every day in medicine from medical errors, and I'm here to bring aviation safety to military medicine. Yes, across this country, 444,000 patients die every year from medical errors. Last May, I attended the Senior Preventative Medicine Leadership course for the Army. When we're given an opportunity to ask the senior leaders questions, I simply asked, "So we skipped 2 years of phase 2 trials and 3 years of phase 3 trials. We only lost 12 active duty soldiers to COVID. Yet we're going to risk the health of the entire fighting force on a vaccine we only had 2 months of safety data on? The response was, "You're damn right, Colonel, and you're going to get every soldier you can to take the vaccine so I can get enough data points to determine if the vaccine is safe." Our service members are national treasures. They have stared down bullets, been blown up by IEDs and bombs. They have endured thankless and protracted wars, missing the birth of their children. They bore the burden no matter the cost. They did so without respect to political party or narrative. These are warriors, not lab rats. They deserve the best medical care. At the onset of the vaccine rollout, I had a colleague who took the vaccine to protect her elderly parents. She's a brilliant officer and a doctor. She's deployed twice. After the vaccine, she had fever, significant pain, lost all range of motion in her arm for over a week. That was the first time I looked in the vaccine adverse event reporting system to see if her symptoms were common. What I found horrified me. I found the bearers in only a few months into the vaccination campaign already had more deaths than in any year for all vaccines combined in each of the 10 years previously. I subsequently went to Fort Benning, where I encountered numerous soldiers who told me of threats, coercion, and intimidation to get the vaccine that were at that time still under EUA. This violated medical ethics, specifically the Nuremberg Code. When I emailed Army Public Health Command and asked about adverse events, the epidemiologist emailed me back and told me that they were not tracking, tracing, or monitoring adverse events. I received an email encouraging military healthcare providers and professionals to get vaccinated, put a sticker on your uniform, post it to social media with the hashtag the vaccine safe, hashtag get vaccinated. This disturbed me because it seemed as though healthcare professionals were being used as the marketing arm of pharmaceutical companies. Many would say this is just good public health messaging, but I would say this is a violation of DODI that prohibits endorsement of a civilian product. Yes, these vaccines are a product. The pharmaceutical companies are not benevolent charities. They are there to make a profit, and they are. In May, I came across a young woman, a collegiate-level athlete, training for Ranger School. She was everything we wanted in a female warrior. She had a promising career ahead of her. She told me that she was the only female in her Ranger School class and the only one not vaccinated. She went on to tell me of the level of harassment and intimidation soldiers were facing for not getting vaccinated. She expressed her concerns about the effects that the vaccine might have on her fertility and health. I walked her through the potential risks and benefits for her age, physical condition, and fitness. I told her, you have everything to lose and nothing to gain. She reached out and sent me this message. The time and pressure got the best of me. I know I met you for a reason, and there were so many signs and so much guidance against getting the vaccine. That day I spoke to another mentor who told me the vaccine is the future and leaders make sacrifices, sometimes so they can be there for their people. I went forward with that, feeling like it was going to allow me the opportunity to look out for others. I hate to say how much I regret the decision. It's been a little over 2 weeks and my body isn't right. I was in such a strong place physically and ready for Ranger School, and about a week ago, everything changed. I began hurting, having cramping, back pain, bruising, coughing. I ignored it because I really just wanted to go to Ranger School. It's everything I'd ever worked for. I shaved my head and left Sunday to get my tab, and my body shut down on me out there. The 5-mile run I've been run a million times beat me. I couldn't get my body to move any faster. I was in pain, not for being out of shape, but for whatever was happening inside my body. I was dropped from the course and went and saw a doctor. I don't know why, but I wanted to reach out to you and tell you how grateful I am, regardless of the fact I failed to see the signs, and trust why God brought me to you that day. Thank you for trying to reach me. Thank you for caring about my health more than my job. I wish there was a way to undo what has happened, but I can't. And I just try to move forward and get to a better place. I want to thank you again. I hope you continue to help people who haven't put themselves on the other side. Hearing her disastrous side effects was like looking in the mirror. I saw a promising young officer at the beginning of her military career knocked off her trajectory. It was later on that I reached out to Dr. McCullough, who invited me to be a group of hundreds of doctors, scientists, and mathematicians from around the world looking at early treatment and vaccine safety. One of the things that this female's story highlighted the most for me was that women had unique considerations than men and postmenopausal women. Women in their childbearing potential have all the eggs they'll ever have from conception until menopause. Their exposure to various chemicals, toxins, drugs, and x-rays can not only affect their health, but that of their children and their ability to have children. I did my research. I found 8 out of 10 drugs pulled off the market disproportionately harmed females. Doctors across the country should have been humbled when medical schools taught them the lessons learned from drugs like thalidomide and DES. DES was a synthetic estrogen given to women without problem. They had children, but the daughters of mothers who took DES got to be about 18 to 20 years old, and they developed rare genital cancers and infertility at an alarming rate. It took 40 years for the medical establishment to figure out that DES caused transgenerational infertility and cancers. And this was a drug that went through standard clinical trials. There is no substitute for time. You can throw money at things, you can cut regulations, but there is no substitute for time. In June of 2021, the CDC announced that they were holding an emergency meeting to discuss higher than expected myocarditis in 16 to 24-year-olds. Despite this announcement, the military did not even pause their vaccination efforts. Why? I made numerous efforts to get senior medical leaders to, at the very least, inform soldiers of the risk. Leadership ignored my concerns. This is very troubling for many reasons. You can't have informed consent if you don't tell your patients of the risks and benefits of a treatment or procedure. With respect to aviation safety, risk communication is critical. I saw 5 patients in clinic, 2 of which presented with chest pain, days to weeks after vaccination, and were subsequently diagnosed with pericarditis and worked up to rule out myocarditis. The 3rd pilot had been vaccinated and felt like he was drunk, chronically fatigued within 24 hours after vaccination. The pilot told me he didn't know what to do, so he drank a lot of coffee to try and, quote, wake himself up, and continued to fly until he realized it wasn't going away. After I reported to my command my concerns that in one morning I had to ground 3 out of 3 pilots due to vaccine injuries, the next day my patients were canceled, my charts were pulled for review, and I was told that I would not be seeing acute patients anymore, just healthy pilots there for their flight physical. There's a concept of the 10th man, the loyal dissenter. That's the person that you select to be the dissenting opinion to prevent groupthink. Patients are entitled to a second opinion on their medical care. What happens when bureaucrats mandate that there is no dissenting opinion? In the military, flight surgeons can only make recommendations as to if a pilot is fit to fly or should be grounded. Ultimately, it is the commander taking on the risk and makes the final call to accept or reject a flight surgeon's recommendations. Fellow Americans, you are the ones taking on the risk. My recommendations are that Dr. Fauci and the members of the FDA and NIH are unfit to fly this plane. They need to be grounded. Before COVID, I told you medical errors killed the equivalent of 3 Boeing 747s packed full of patients every day. Medicine is not perfect. Doctors are not perfect. This vaccine is not perfect. Yet we are mandating every single American get on board a single aircraft piloted by bureaucrats and administrators who are unfit to fly the aircraft. They need to be grounded. These are not leaders. These are administrators faithfully implementing policies. There is one narrative, that the vaccines are safe and effective, but neither are true. Senator Johnson, I want to thank you for being a loyal dissenter, for doing your job and being a leader. I hope the American people do not let fear, division, and threats guide your actions. Seek wisdom, pursue truth, and put your trust in the Lord. Hold the line.
Thank you. We're going to switch a bit to talking specifically about safety and about harms. And we're also going to talk about the crisis and decision-making that we're having, and that we're making decisions based on uncertain data and non-transparent data. But first, we're going to hear from Ernest Ramirez, who's going to tell us about his experience, his family's experience with vaccine injury.
It'll work? Yeah. I'm from Edinburgh, Texas. Excuse me. I was a father of a 16-year-old son. A single parent. I raised my boy since he was a baby. He meant the world to me. I got the vaccine to protect my son. And after in March, April, they're announcing how it was safe for teenagers. Me and my son have never been apart. We're always together. He was my best friend. I always told him it was me and you against the world. He was a good, at the age of 7, he wanted to play baseball. So I ended up coaching Little League Baseball for 7 years. He was a heck of a baseball player. Then he was telling me he wanted to join the Air Force. So I said, good, that's good. I'll back you up on anything you want to do. He joined ROTC in high school. He was always full of smiles. Anybody that knew my son would see he was happy. I wasn't rich, but I gave him everything he wanted. We didn't lack for anything. We used to go fishing, camping, do everything. We got the Pfizer vaccine because I thought it was to protect him. I thought it was the right thing to do. It was like playing Russian roulette. My government lied to me. They said it was safe. Now I go home to an empty house. Where I used to wake them up, I'd give them a hug and a kiss, tell them I'm going to school, don't miss school. I'd get home from work, he'd come running out. He knew when I'd get home, he'd come running out, give me a hug. I'd give him a kiss, a hug. What do you want to go eat today? Like I said, he was my baby boy. Everybody knew we're always together. Like I said, next week is his birthday. You know where I'm going to celebrate his birthday at? While everybody, once we leave here, they're going to forget about what we're doing or what they talk about, what we said here. They're going to be enjoying time with their family and kids. Thanksgiving, I'm going to spend at the cemetery. Christmas at that cemetery. They need to quit pushing this on their children. I lost mine. Y'all need to protect yours. They're trying to target the 5 to 12-year-olds, we're going to have more deaths in our hands than they planned. And they say it's worth the risk. It wasn't worth the risk to me. My son was the world. He meant the world to me. They could never give him back to me. That's all I want is my son back. So don't make the mistake I did. I did it because I thought it was the correct thing to do. It wasn't. It was not. Like I said, I've always said I love the hell out of my country, but I don't trust my government anymore. I'm here because I'm Junior's voice. I'm doing this in my son's honor. If I can protect 1 or 2 children, that means the world to me. And I'm going to continue this fight. I don't know why I ended up here. Something told me to come here. And I know this is not the end of the road for me. I'm going to continue. I'll find out where the next stop is. We need to protect our children. Oh, excuse me, I'm sorry. Mr. Johnson, thank you. I really appreciate you talking to me and helping everybody, not just me, everybody, every one of us that's going through this deal. I mean, like I said, what they did to my son, they knew what was happening. I consider that murder. Because in December 17th, 2020, they did a study, and they knew they caused heart conditions in teenagers. Why wasn't this information released until October 1st this year? If we would have known this, my son would be here with me. So I figured, like I said, they murdered my son. And the other people that are suffering, these kids, with all these side effects, that's child abuse right there. I mean, why isn't something being done? I mean, this should be pushed. We don't let anybody hurt our children. We put our lives in front of our children. Why are they doing this to our kids, man? Like I said, I have nothing else to lose. I mean, everybody needs to stand up with me. We all need to fight together. At least do better tests to make sure we're not going to hurt any more children. I'm sorry, thank you.
Ernest, thank you for sharing your painful story. We are all so sorry for your loss. This is real. I wish the agency heads were here. I wish more of the mainstream media was here to listen to these stories. I would just suggest we hear the stories from the vaccine injured, and we'll move to the academics next. So that would be my suggestion here. I think that'd probably be best. So if we could go on to Kyle, if you're ready. Now, please get your microphone right up to your mouth so that people can hear the stories. This America needs to hear this.
Well, first of all, for anyone who is just maybe catching it right now, I hope that you go back and listen to Ernest's story, because what he went through is something that no parent ever wants to experience and no one should ever experience. Before I started my speech, I just want to say thank you to Dr. Fauci, to the FDA heads, CDC, NIH, everyone for not showing up to this meeting and not listening to us. I really appreciate it. I'm glad that you have our interests at heart. This message is kind of for you. It's a message on how what's happening has broke my heart literally and figuratively with our country. My name is Kyle Warner. I'm a 29-year-old professional mountain bike racer and 3-time national champion. For most of my life, I have focused on being as healthy and positive as possible and inspiring other people to do the same. Growing up without much money and with a household that was broken, family battling drug abuse, prescription drug abuse, and addiction, I never really felt like I belonged to much of anything. However, I spent each morning before school with my hand over my heart, pledging allegiance to the flag. Thousands of times I spoke these words: one nation, under God, indivisible, with liberty and justice for all. Being a part of this country inspired me to chase my dreams and granted me the freedom to do so. This spring, when the current administration was urging young, healthy Americans to get vaccinated to help end this war on the pandemic, I stepped up. I wanted to serve the greater good. I wanted to help fight this war, not because I was afraid of COVID, but because my country asked me to. You told me, this vaccine is safe and effective, period. And I believed you. This time, I ended up with my hand on my heart for a different reason. In June, I joined the rapidly growing number of young men who develop pericarditis post-mRNA vaccine. That is the inflammation of the liner surrounding the heart. That condition, along with POTS and reactive arthritis, have completely brought an end to life as I knew it. I have been bedridden, unable to work, and unable to exercise for months. I fear that my career has officially been ended. Listening to these stories today and looking at the VAERS database, it is easy to see